The program is easy access to healthcare for all Nigerians as we bring you the efforts of the National Health Insurance Authority in its quest to attain universal health coverage for Nigerians. My name is Aisha Muhammad Ahmed. The NHIS operational guidelines are like the holy book upon which the National Health Insurance Scheme in Nigeria is run. It prescribes programs as well as practices under the scheme. Who is eligible? What benefits and packages are dispensed, as well as accreditation requirements, among other things. These guidelines have been long overdue for review. Towards this end, the NHIA has put machineries in motion to carry out this much-needed review to bring the guidelines up to date with present trends and realities. On the program tonight, we shall bring you details of what has been done, as well as a recent activity in the bid to review the operational guidelines. Details in the course of the program. Please stay tuned.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
Easy access to healthcare for all starts with news from the National Health Insurance Authority at the headquarters and from the state as the agency works towards achieving universal health coverage. Stay tuned for the NHIA News Diary.
Director General of Roche Pharmaceuticals, one of the partners with the National Health Insurance Authority (NHIA), recently paid a visit to the authority to update the NHIA on the implementation of the initiative in the pilot states. Roche Pharmaceuticals signed an MOU with the NHIA about a year ago on the provisions of cancer drugs to enrollees of the scheme.
All of you for giving us this.
General Manager of Roche Pharmaceuticals Limited, Dr. Ladipo Hamid, while speaking, said that the results from the test run has so far proven to be successful.
In partnership with the National Health NHIA, we're very pleased with the progress we've made, and we think it very pertinent to at this point share the success stories for what we started about 6 months ago, and then also some of the asks for how we can move it forward, that it becomes a part and parcel of the lives of Nigerians. So I know the DG was very clear on data collection when we were starting this project. So we really focused on being able to share the data with you so we can make the necessary decisions and see the overview.
The Director General of the NHIA, Professor Mohammed Sambo, while responding, commended Roche Pharmaceuticals for the work done so far.
Definitely we need to develop a strategy on how to expand this program to cover other regions that are not currently benefiting. And we need to really have a very close engagement with the health maintenance organizations. This is very critical. I don't know whether we need to invite them to specifically discuss this issue with them. We need to track all the enrollees that have been diagnosed to have cancer under our care. And if we identify them, we need to see how we can ensure that there is interface between NHIA and Roche so that they can benefit from the program.
Acting Coordinator of the Edo State Office of the National Health Insurance Authority (NHIA), Mr. Ihanire Theodore Osas, has continued sensitization activities with critical stakeholders in the state towards ensuring a full implementation of the mandatory health insurance in Nigeria as provided in the new NHIA Act. In a courtesy visit to the Federal Road Safety Corps (FRSC) Edo State Command, Mr. Ihanire stated that such collaboration was necessary, especially at a time when the authority is working assiduously to expand coverage. The acting coordinator also added that the new NHIA Act emphasizes on promoting, regulating and integrating all health insurance schemes in Nigeria in order to drive the nation's health sector towards attainment of universal health coverage. He used the occasion to sensitize members of the Corps on NHIA flagship program, the Group, Individual and Family Social Health Insurance Program, GiveShip, a platform to expand enrollment to the informal segment of the population. Corps Commander, Federal Road Safety Corps, FRAC Edo State Command, Ogwe Paul, while responding, thanked the Edo State NHIA boss for the visit and promised his support whenever it is needed.
The program is easy access to healthcare for all, detailing activities of the National Health Insurance Authority, providing health insurance and taking Nigeria towards universal health coverage is a task that involves several stakeholders. For proper understanding of roles, there is a set of regulations that specify functions and duties of these stakeholders and even prescribe sanctions. This body of rules is what is known as the operational guidelines. About a month ago, the NHIA commenced the process of reviewing the operational guidelines, especially in the context of the new Act. Our next segment, Issues Around the NHIA, brings you up to date on the efforts so far towards reviewing the operational guidelines of the NHIA. Do keep watching.
The DG and members on the IT.
The National Health Insurance Authority on Friday 10th February 2022 inaugurated a committee for the development of operational guidelines for the NHIA. The objective of the development was to review the extant operational guidelines of 2012 to develop NHIA operational guidelines in alignment with the NHIA Act 2022 and to itemize operational principles for the implementation of the NHIA Act 2022, as well as to develop strategies for the transfer of knowledge of the content and context of the NHIA Act 2022. While inaugurating the committee on that day, the Director General of the NHIA, Professor Nasir Mohammed Sambo, described the review as necessary.
So this committee that we are inaugurating today is going to work to develop a revised guideline. We call it a revised guideline because we already have a guideline with respect to the other law. But now with the modification of the law, we now have to look at the guideline and see, we now have to look at the law and see how we can improve or review our guidelines. So this activity that this committee is going to do is not a simple task, because as a young man, I was part and parcel of developing the initial guideline. I know how difficult it is, because revising the guideline will entail you to read all the content of the law very clearly, so that whatever you are putting in the guideline will not be in contravention with what is obtained in the law.
The committee, which comprised stakeholders across different spheres of the health system in Nigeria, was further divided into subgroups to address the various challenges affecting social health insurance in Nigeria.
The DG has started by telling us...
About a month after its inauguration, a 3-day workshop was again organized in order for subcommittees to submit their work to the General House for consideration towards developing a draft of the new operational guidelines.
What we have developed.
Director General of the NHIA, Professor Mohammed Sambo, while opening the event, said the exercise will only approve and adopt submissions that will deepen the understanding of the guidelines and meet the requirements of the new law. The meeting, according to the Director General, will also look at the innovative means of financing healthcare, especially for the vulnerable, in line with the new Act.
We have to be creative, we have to be innovative to be able to push that law to make it workable as a mandatory law. Secondly, we cannot finance this law through general tax revenue. This is very, very clear. For us to be able to implement the content of the vulnerable group funds, which constitute about 83 million as encapsulated in Lancet Commission report, and about 100+ million according to the National Office of Bureau for Statistics. we know that that money cannot come through general tax revenue. So we have to be innovative, and we must cash on this transition period and the popular debate of the pending removal of oil subsidy. The NHIS.
Speaking in an interview, Professor Mohammed Sambo, the Director General of the NHIA, gives more insight into the need for the 3-day workshop.
The guideline that we were using under NHIS has to be reviewed to conform with the new guideline. We set up a committee, we inaugurated the committee, and the committee started work in earnest. After the inauguration of the committee, and so many thematic areas were developed, about 6 of them. So the group have been working under these thematic areas. So today we are reconvening to continue to look at all the thematic areas with a view to bringing a finalized zero draft document of the revised guideline, because the guideline will now be the subsisting guideline that will be used in driving the mandatory social health insurance, which encapsulated the vulnerable group fund aspect for the coverage of the poor and downtrodden.
The session, which was divided into groups, afforded participants the chance to discuss the various thematic issues that will guide the operationalization of the new NHIA Act.
500 lives.
The participants were also reminded to work with considerations to the different states in Nigeria and their peculiarities.
When we discuss in various groups, we'll be able to know that states are different. Federal, states, we need to align, and then come up with something that is robust and will be workable. There's no point having operational guideline that everybody will just be throwing under the table and say, and when NHIE, they don't come again with English. It's not practicable. So I think that is key and crucial.
Preparing the document to encourage group practice among health workers was encouraged as well, while also putting into consideration the capacity of the healthcare providers.
As much as possible going forward, we want to encourage group practice. If doctors will come together with pharmacists, with lab scientists, we are safer where we are. And that's the future we think hospital services, healthcare services will go in this country, where people begin to come, the dentist, the ophthalmologist, optometrist is working with doctors, they set up facilities and they can give comprehensive care. Going forward, we are looking at a unified benefit package. We may not be totally there yet, where from Oyo to Cross River and to all that, we have the same benefit package, but we are not there today.
After the syndicate session, submissions were made by the various group members, spanning across the role of healthcare providers in providing healthcare, as well as an adequate and uniform medical benefit packages for all Nigerians.
From the last health account study we did, we found that over 82% of primary care services are not procured from primary health care centers. They are mainly procured from tertiary centers. And what does it do for us? What it does is that we are certainly paying more for primary care services when they are procured from tertiary centers and secondary centers than at the primary health care centers. So for us, it's a major area of inefficiency that has to shift.
From day one, you cannot jettison PPP, public-private partnership. What we seem to be embracing much more, even in insurance like we're doing now, is public-public partnership. I promise, sir. And I will land. I know where I'm going, sir. The money we take now, sir, as we have from this basic something, we are using them to develop primary health centers. That is what we are doing. We are building structures. We are trying to revamp, and we are building structures. It means certain things must also suffer along the line. Even after making everything beautiful, where is the human resource to manage all of this we're talking about? Let's start from the beginning. Honestly, I don't want to see that word again, basic minimum. No. I want every Nigerian to get an adequate uniform medical benefit package. Please, let's change that name. If we can start from that, Nigerians will always applaud us.
Participants at the event gave their various takes on why the brainstorming session was necessary and how it will go a long way in establishing the act for the benefit of Nigerians, especially the poor and the vulnerable.
This current meeting is to consolidate on the inputs that had been received by the various members of the committee, the initial work they've done, and the various memoranda that the agency has sent out and has been received. This committee now will work on it and tease out the essential components of the various memoranda that have been given to the agency to enrich the operational guidelines.
The NHIA now is trying to develop a secondary law from it, and by this secondary law I mean the operational guideline that will guide the system in fulfilling the provisions of the acts. And so different people from different stakeholders in the health systems are here, gathered to make their own input, either as a body or as an individual, to enrich the operational guidelines such that the whole essence of the act is met, and then we are able to also bring the Nigerian health system, make it grow, allow the system to work efficiently, and that's the main reason why all of us are here.
The Act intends to provide social health insurance for every Nigerian, mandatory health insurance. The Act is posed to provide what we call the Vulnerable Group Fund, which will provide fund and access to health care for over 83 million Nigerians who cannot pay for their health insurance policies.
Other participants at the workshop commended the NHIA for the initiative.
This is a very interesting moment for Nigeria, where the government of Nigeria has decided to review the National Health Insurance Act. And we see a lot of opportunities, we see a lot of potentials for accelerating Nigerians' journey to universal healthcare coverage. And the exercise going on is really doing a technical review of the implementation of the health insurance in Nigeria. Very holistic, comprehensive review, looking at where we are coming from, what are the issues, what are the challenges, and what needs to be done differently in order to accelerate the journey toward UHC. The NHIA, I must give credit to NHIA for doing this, bringing all the stakeholders on board.
Thanks for staying tuned. The program continues with our stakeholders segment, and our stakeholder this evening is Mr. Famorio Olufemi, the General Manager, Princeton Health Limited, a health maintenance organization. Mr. Olufemi says ensuring that enrollees get quality services for their money is one of the major responsibilities of the HMO.
It's one thing for you to say, enrollees, because there's actually a procedure, there's actually a process, when you get them registered with the healthcare providers of their choice. It is not enough to say, okay, we have actually registered you. You must also take a step further by ensuring that they have quality access. You know, some of these, one of the things that we do at the HMOs through the quality assurance aspect is to ensure that we go to these healthcare providers and look at the quality of treatment they're actually offering to the healthcare to the enrollees. You know, of course, out of every 12, there's always a Judas. There are some that are actually, you know, discharging their responsibilities as they should be. You know, while we also have some who are actually trying to cut corners, and it is our responsibility to ensure that we nip those activities in the bud. We ensure that they are, once they are identified, once they are caught, we ensure a process through which they can be dealt with. You know, and you know, once we are able to do that, the enrollees will be actually better for it.
Mr. Olufemi also explains that the National Health Insurance Authority gives priority to constant monitoring of all its stakeholders to keep them on their toes and ensure that the mission of the authority is not jeopardized.
I think it's a right step in the right direction. Okay, and I think it's something that they do from time to time. They go, you know, check books of the HMOs, make reconciliation, you know, see where the HMOs are actually defaulted and things like that. It's a going concern, and it's something that they do. And I want to believe that any HMO that has been existing for quite some time now should have gotten used to that. Even not too long ago, they came, you know, and it's something that they have been coming to do for some time to time. I think it's a right step in the right direction. It's going to make everybody to sit up, you know, and you know that whatever you are being given to pay on behalf of these enrollees is not going to be national cake. You have to be responsible for whatever amount of money has been given unto you, and it's also one of the ways through which you can prove your accountability.
Mr. Olufemi throws more light on the working relationship between the NHIA and its major stakeholders like the health maintenance organizations, the healthcare providers, and the enrollees.
We all know that the NHIA is a regulatory body, and of course, we are partners in progress. Okay, the HMOs, the healthcare providers, even the enrollees, we are all partners in progress. Okay, and of course, like I said, the HMOs are actually an important part of the scheme. Okay, and from time to time, we usually do hold meetings. They will call meetings in Abuja when there are issues. We iron the issue out. We discuss issues as we believe affects the smooth operation of the scheme. So the relationship has been so wonderful.
There is no program without its challenges. HMOs, however, believe that the effort of the NHIA in achieving universal health coverage is commendable.
The experience has been so wonderful. Of course, there are issues that personally we want them to look at. Okay, the issue of fee for service. Okay, I'm sure you understand what I mean by fee for service. There is no HMO that you meet or discuss with today that will not complain about the issue of the fee for service. It's a major issue. To be honest with you, they have a lot of programs now. And it's actually geared towards ensuring that everybody have, you know, access to health insurance in the country. That particular aspect, they have to be commended for that. They are not actually sitting back. The way people perceive health insurance in the country now through the NHIA is a lot better than what it used to be. And of course, we will expect that it will continue to get better.
And that's all we have for you today on the program. Join me again, same time, same station next week for another episode. Until then, stay safe.